Hello again, Dr. Herman here. I've got a great patient update to share with you. For those of you wondering what kind of conditions can be helped with the type of work that I offer, and with me is a wonderful patient. Her name is Dahlia, and I'm going to let her talk because she's got something to share.
So first of all, it took a lot of encouragement for me to do this, but I think that the main point in here is not about me, but how can I help other people that maybe have felt the way I did. I'm now 54 years old, but when I was 52, up to the age of 52, I can say that I was probably the healthiest person around. I've never had any kind of sicknesses. A cold was the most that I ever had. I did have a thyroid condition, but I knew that if I take the Synthroid and I take the proper medication, it was going to be fine. And so I wasn't prepared at the age of 52 to start having aches and pains all over and not know why. I ended up going from a doctor to a doctor, and they all said that I was just fine. It's my thyroid. I have Hashimoto, but it's treatable. Everything is fine. There's nothing really wrong with me. But it was getting really worse and worse, and I ended up, again, going to different doctors, trying to figure out what can be worse than what's going on. And
what could be causing what's going on, or what can be worse than what's going on?
No, I mean, what was causing it? But it was getting worse.
What was getting worse? What were you feeling?
Okay, so I started to feel like when I walk, I get this imbalanced feeling.
Imbalance, you were falling side to side, falling forward, you felt dizzy?
I can't stand in one place for long. I feel like I always have to hold on to something, but I wasn't sure what it was. When I would walk, I would be fine, but when I would stand in one place, it wasn't right. And I went to, a nose doctor to try to figure if it's, the imbalance in that, and it was not that. Anyway, then I start feeling even worse. I start feeling, okay, I had panic attacks, which I said, okay, maybe it's not that bad. Maybe it's something that, by taking medicine, I could be fine. And I would take antidepressants. But the antidepressants, which I was taking for years, were not helping any.
How many years had you, I'm sorry, how many years
like
had you
20 years that I was taking Prozac.
Oh, okay.
So I realized that something was shifting. Like I wasn't feeling good with the stuff that I was taking. So I tried to change my antidepressant. I tried to change the thyroid medicine, but it was just getting worse. Another thing is that with me like walking not straight, I also start developing lower pain in my back, and all of a sudden I start feeling tired and wanting to stay at home more and more. And, there were days where I could not even go to work. And this was getting a little bit too much for me. And being very, very stubborn and always wanting to find a solution, I started looking in the internet. And that's when I found Dr. Herman, which I did not believe that he could help. But I decided to come anyway. And so I did. And I was a little skeptical at the beginning, but I think right at the beginning, with the first remedies, I already started feeling a relief. The first one being that I wasn't as tired, so I could go to work. My pains weren't as much as they were before. And I started getting better and better little by little. Also, I think that some of the help that he gave me was also in the diet, in the way of thinking. And it also, a lot of it was emotional too, and he helped in that particular point also. So I think that overall, if I came and I was feeling like he would say how much in percentage, and I would say I felt 8 or 9 in pain. Today I feel maybe 1. Excellent. Maybe 2, it depends. I mean,
and there was no back. We didn't really do any kind of back therapies for long, if anything, right?
Nothing.
No, it was all brain.
It was all brain. It was emotional. Yeah. It was, you get anxious because you think you're dying, and you don't know what are the symptoms, what makes you, and you don't know where the end of it is. And
I remember certain days, I'm sorry to interrupt, I remember certain days of you coming in where the anxiety had gotten because the imbalance was so bad, that the anxiety was so bad, compounded by the imbalance problem. The anxiety was really driven by the imbalance disorder.
True.
You say that?
True.
And until we could really crack the code, and it took us several months. This was not an overnight.
No, it
you
wasn't.
did feel better after the first session, but it took us months to be able to finally unravel all the causes of what was going on with the brain that made, and it wasn't just a functional therapeutic brain-based therapy that did it. It was getting rid of, because there were infections in multiple places and so on. It did take us several months to finally to get to the point where you said my balance is not off and my anxiety.
For sure.
Yeah.
I feel that you just, I mean, at the beginning, you might think that this is like a hocus pocus. It's something that is different, and it is. But, you know, if you go with an open mind and you realize that in your own self you have all the answers, then I think that you will see that your body does give the answers and that you could get better within yourself. You don't take any drugs, anything that's harsh. It's really nothing. But you do learn that it's your body who tells Dr. Herman, he tells the other person what is wrong with you. Mm-hmm. And so the whatever he's doing is exactly for what you have. Yes. I will say that at the beginning, when I used to watch these interviews or whatever you do with the people, and I would say, it's probably impossible. It's probably something that he must have paid for that in order for them to say that. But I've decided that it's about time that I say something too, because you can get rid of your anxiety. You can get rid of your imbalance. I'm not quite sure how, but yes, you can get rid of all of those things. So I do want to thank you for that. Okay?
Thank you.
You're welcome.
And it's real. I don't know what to say. No, I'm a bit touched up. I didn't know you were going to be so good at speaking in front of the camera, Dalia. But,
okay. Also, I'd like to say that, you know, I come originally from Israel, so if I could say a couple of words in Hebrew. זה דבר שזה עובד. הגוף מסביר לנו מה יש לנו שהוא טוב ומה יש לנו שהוא לא טוב. זה דרך אחרת, זה לא דרך רגילה, אבל היכולת של דוקטור הרמן להראות את הדרך הנכונה בשביל להבריא היא קיימת, וכדאי לנסות את זה. זה עזר לי, ואני מאמינה שזה יכול לעזור לכל בן אדם. רק צריך לצאת מהדפוסי התנהגות והדפוסי חשיבה שמשהו כזה לא יכול לעבוד, כי הוא עשוי על בסיס נטורלי. וזה לא נכון, זה כן יכול לעבוד וזה כן עובד. אז אם אתם מאזינים, בבקשה, אני באמת עושה את זה כי אני מאמינה בזה, ותודה. That's it.
Thank you. So we can get well. There are balance disorders that come from other places in the body that we've got to find, and we can unravel for you, and there's no reason for you to continue with your serious balance disorder. No reason at this point. You can see there's no reason to continue with feeling anxious or depressed. There are ways that we can help you unravel your chronic condition, and in the majority of the cases you can either decrease greatly the medications you're taking or even eliminate them. Whether it takes you a month to see some changes, whether it takes you a day to see some changes, or whether it's going to be a process, and usually it is a process that it could take us months down the road before we're going to see relief of these signs that you have. So not always is it a quick fix, but we do experience those as well. I want to thank you for helping me share this, and you have already shared, because I know you've referred people in here, so
yes,
we're grateful for that as well, and we're seeing great results for them. Okay, you can call our office, always subscribe on the YouTube page here, and I look forward to helping you as well.
Thank you.